we're definitely escalating when we think about our the illnesses or injuries that we're working on right now. So when we're talking about head or brain specifically, neck and spinal injuries, kind of moving up the realm here. So to preface this, if you have any sort of superficial scalp injuries or any sort of bleeding of the head, it's important to know that any head injury is going to have a lot of blood. Okay, it doesn't necessarily mean that it's life threatening. It's just for obvious reasons we have a lot of blood going to our head, right? Now, it doesn't mean to take it lightly. I just want to prepare you that if you see any sort of head injury that has a superficial scalp injury, that there will be a lot of blood. Okay. This can also result in a bump on the head, which you would want to monitor and be aware of. And then you're going to care for the wound as appropriate. We will get to wound care here in a couple lectures. But going to want to stop the bleeding and make sure that you're applying several dressings and keeping things clean, making sure that if you feel any sort of depression, spongy area in the bone fragments, do not put direct pressure on the wound, okay? For any sort of bump, apply some sort of cold pack or to try and reduce swelling. So serious brain injuries, some of the things that we're looking for is any prolonged unconsciousness with no response to aggressive stimulation. So you're tapping and shouting on someone's shoulder, you're hitting the bottom of their feet, whatever the case may be, you're saying their name and there's no sort of response. That is assumed in the backcountry to be a serious brain injury. Any sort of possible skull fractures, and the signs of symptoms of this is any sort of depression in the skull. Make sure that you don't push on it, right? You'll feel it by touching lightly. Any sort of fracture that is visible in the scalp or it's torn, and any bruising around the eyes, you'll notice in figure 2 there, that bruising, okay? And any sort of clear fluid or even blood dripping from the nose or behind the ears. So when we're doing our full body assessment, we're told to look for that, right? We check behind the ears when you watch that Knowles video, and that's what you're checking for. Any sort of bruising or bleeding inside the ears or nose, like the figure 3. Again, in the backcountry, this is assumed to mean a serious brain injury. A person's inability to sense touch or move their extremities, eyes that do not respond to light appropriately. So if you take your phone out or your flashlight or your headlamp and someone's eyes are not dilating properly and their pupils are not responding, assume serious brain injury. Any sort of mental status deterioration. So if the person is disoriented or irritable or combative, this can lead to a coma. And so again, this is that, are they alert or not? Are they able to answer questions or not? Okay. Any sort of personality changes, loss of coordination or balance, extremely bad headaches, and vision problems. Again, doesn't necessarily mean serious brain injury, but in the backcountry, that's what we'd assume. Okay. On the other hand, when you have your mild brain injuries, the things that you're looking for is any short-term, less than 3-minute loss of consciousness, short-term and amnesia. So I remember being on the horse, I remember being on the ground, but I don't necessarily remember my fall. Okay, that's a relatively common response. However, I don't remember what day it is, where I am, or what my name is. Very serious altered mental state. Briefly blurred vision, okay, so that comes back. Any sort of nausea, headache, dizziness, any neck tenderness associated with a spinal injury, okay? So how do we give care for mild brain injuries? So any sort of wound there would be, we would dress that appropriately. We would monitor the person for 24 hours, and we would make sure that the person doesn't sleep for longer than 2 hours. And we're checking to make sure that their mild brain injury symptoms haven't turned into serious brain injury symptoms. Serious brain injuries are automatic, rapid evac. Mild brain injuries are a monitor, okay, with a choice to evac or a slow evac if you feel like that person can move out of that country. So And we'll go over that shortly. But so to give care, we're going to immobilize the person, and we always want to assume a spinal injury. We will get to that shortly here, okay? So again, evac, go fast if it's life-threatening. A serious brain injury is considered life-threatening. You will know this because that person will be in that altered mental state. It will be scary to be seeing that deterioration, okay? Rapid evac. So you're going to evacuate quickly if any signs or symptoms of severe. However, you can make sure to monitor the person by testing their balance, by asking them questions, and seeing if there's any sort of deterioration. A person with a serious head injury should be carried. We don't want to walk them out, versus a mild brain injury could be a slow evac where you're walking them out or they're walking themselves out. But there's no reason that someone with a serious brain injury or a serious head injury should be walking out on their own. Okay, so that might be in the case of a litter, that might be in the case of, which you'll see in figure 4 there, or it could be in the case of calling for an evacuation assistance. Okay. So spinal injury. So this is the damage or potential damage to a spinal cord. And I say potential damage to the spinal cord because we don't have a way of actually testing that in the back country. So we have to make some certain assumptions about what happened. Okay, so when we talk about the MOI, that's the mechanism of injury. So what caused that spinal injury, and why should we assume that there is a chance for a spinal injury? And that will give us the information we need to know whether or not we should move forward. So falling from a height or landing on the head or spine. So any direct landing on your head or your spine. I think the easiest thing of this would be being flung from a horse in the Sierra, right? You're on a packing trip and you fall off your horse and you fall directly onto your spine or onto your head. The other thing is falling and hitting the buttocks that may transmit a force. So if anyone's ever had a serious tailbone injury, when you hit that tailbone, it's not just the tailbone that hurts, but there's this jolt up your spine, and that can cause trauma to the spine as well. Okay, any fall at a distance greater than the person's height, we're always going to assume that there is a chance for a spinal injury. Again, we don't have a way to check these things. Well, at the WUFA level, if you want to be able to clear someone for a spine injury, then that would be that WFR, that Wilderness First Responder level. Okay, but at this level, what you're learning here, we assume that greater distance of a height, we assume spinal injury than the person's height. So having chin force to the chest, right? So the chin coming down and hitting the chest with force. Any excessive tension or rotation. So downhill skis where the skis don't release, right? And so there's this really, an example of that would be that where there's this really intense fall that takes place, okay? Pulling or jerking of the head from the neck, gunshot, stabbing, or other injury that penetrates the body in the area of the spine, we assume a spinal injury. Sudden and violent or decrease in speed, right? Deceleration, where like all of a sudden you're going at a certain speed and now you're not. So maybe that's skiing again, maybe that's on a bike, something like that. An injury that causes the helmet to break is an assumed spinal injury. Any diving mishaps, so that doesn't necessarily mean hitting the ground. It could also be the way that your back bends when you enter the water, assume spinal injury. Any sort of motor vehicle crash, being thrown from a motor vehicle or by an animal, right? The horse example. And if there's any sort of lightning strike, all of these are assumed spinal injuries. And with assumed spinal injury, sorry, I didn't mean to skip ahead there. Any assumed spinal injuries are going to be, at your level, a rapid evacuation. Okay, so you are going to hold the person in C-spine, which is that picture that you're seeing here on the left. And what she's doing is she is stabilizing his head as the second rescuer would go through that assessment period that we talked about at the beginning of this segment. Okay. If you don't have a second rescuer, you can stabilize someone's spine using packs or blankets or clothes, something that prevents them from rotating their head, okay?